Senator Patty Murray delivers a scathing warning on day 16 of the GOP shutdown, saying Republican inaction isn't just political gridlock, it's a deliberate choice that could rip affordable health care away from millions.
President, while Republican leaders are continuing trying to ignore this healthcare crisis and insisting on shutting down the government rather than even considering talking to us about how we prevent these premiums from doubling across the country, I have been listening to folks back home who are painfully aware healthcare premiums are about to skyrocket and who are deeply concerned about what it is going to mean for their families and for their communities. So last week, when the Republican leaders sent us home, yet again, instead of working with us to end this shutdown and address the healthcare crisis, I made a visit to Seymour Community Health Center's Oak Harbor Clinic. Why? To hear from doctors and healthcare providers about what is just beyond the horizon if Republicans insist on inaction. I heard about how healthcare cuts Republicans passed are going to devastate our hospitals, devastate our clinics and health centers. And I heard about how these massive premium hikes that are being announced right now, the ones Republicans are trying very hard to ignore, are going to push millions of people off their health care plans. One person I spoke with serves on the board of an insurer on the Washington Health Benefit Exchange. He warned me that if we do not save these ACA tax credits, they are anticipating so many customers will be priced out that the number of individuals they cover through the marketplace will drop 35 to 50%. You know, there's already a loud chorus of people speaking out concerned about this in my state and across the country. I have spoken with small business owners who are going to see their premiums double, even triple, and some quadruple, and who are having to rethink whether they try to keep their small business doors open and maybe go without coverage, or alternatively, just pack it in and try to find a job with an employer-sponsored plan. I have spoken with retirees that are not yet old enough for Medicare, who've gotten notice that their monthly premiums are about to go through the roof. In some cases, we are talking about thousands of dollars a month. And here's the thing, not only do I know there are more stories like this across the country, I also know there are going to be many more stories pouring in very shortly. Because the reality is there are rate hikes in the mail right now, going out to people who had no idea about the Republican healthcare crisis and that it was going to hit them in the end. Rates are being set now. People are window shopping in many states and panicking from the sticker shock. In Idaho, open enrollment is now underway. It has started. That means right now families are seeing the cold, hard numbers and the sharp increase it will cost them to stay covered. And in 2 weeks, that same nightmare is coming to every state in the country. Who do Republicans think they are fooling when they try to just ignore this? What in the world are they talking about when they say deal with it later? These price hikes are about to get locked in. There is no later. We need to act now. There was an earlier, though. Perhaps we should talk about that for a minute, because Democrats have been calling for action on this for months. And where were Republicans? Why wouldn't Republicans sit down with us to talk about health care in September? Why wouldn't they talk about health care in August? Why couldn't they find a single minute to work with us on health care in July or June or even May? After all, they had plenty of time this summer to shovel tax breaks at billionaires and put over $1 trillion in health care funding on the chopping block. They spent months on billionaires, but they can't be bothered when it comes to health care. They can't be bothered to help our working families. They would rather shut down the government than sit down and talk about preventing these premiums from doubling. But Democrats are going to talk about health care, whether Republicans want to or not. House Republicans have been hiding from this issue for a month. I'm not kidding. They have literally been on vacation for nearly a month now. Hiding from this problem will not make it go away. Those rate hikes are in the mail. They are going out to our constituents. Window shopping is going live. Folks can now go online in many states and see the exact cost of Republican inaction. And open enrollment is still marching ahead. It is underway now in Idaho, and in a few weeks it's going to be across the nation. If you are a Republican who thinks that somehow families will not notice their premium doubling, somehow they won't mind that their health care costs jump a couple $100 a month, or in some cases, by the way, a couple thousand a month, here's some advice. Stop taking your marching orders from billionaires like President Trump and start listening to those people back home. Talk to the farmers. Actually, a quarter of them are covered on these exchanges. Talk to small business owners like I have. Talk to employees, many of whom are covered through this exchange, because they are the ones who will feel the pain from this, and they know it. And they are begging Congress to act. And you know what? 3/4 of the people who rely on the ACA tax credits live in red states. And the 10 states where folks who lose these tax credits will see the largest premium increases, they're all red states. So shutdown or not, Republicans can only ignore this issue if they ignore their own constituents. So to our Republican leaders, don't hide from your constituents. Don't hide from this healthcare crisis you're causing. Quit hiding from the negotiating table. The clock is not just ticking, the alarm is going off. We need to act now before these premium hikes become unavoidable. Democrats are at the table. We always have been at the table. We're ready to work out a deal that reopens the government and addresses the healthcare crisis. Thank you, Mr. President. I yield the floor.
Day 16. The government is still shut down. Congress is paralyzed. But while Washington argues ordinary people are about to face something far more personal, a healthcare crisis that could drive premiums through the roof and force families to make impossible choices. Senator Patty Murray's speech isn't just another floor statement. It's a warning shot, a wake-up call. She's not talking about abstract numbers. She's talking about real people. Doctors, small business owners, and families back in her home state of Washington who are already seeing the consequences of Republican inaction. She describes visiting a local clinic, Oak Harbor, where health professionals are preparing for impact. Because when Congress refuses to act, it's not the politicians who suffer. It's the patients, the hospitals, the clinics that keep small towns alive. These are the places that lose funding first when healthcare cuts hit, and the ripple effect spreads quickly. Jobs, services, community stability, all of it at risk. And at the center of it all are the ACA tax credits, lifelines for millions of Americans who rely on them to afford coverage. Murray points out what's coming. If those credits vanish, insurers expect enrollment to plummet by up to 50%. That means millions priced out of the market, premiums doubling or tripling, and families left uncovered in the middle of a healthcare storm. The numbers she's citing aren't theoretical. Premiums are already being set. Open enrollment is underway in some states. Families are going online, window shopping for coverage, and realizing they can't afford it anymore. That's what Murray means when she says there is no later. Once those rates lock in, it's too late to undo the damage. She calls out Republican leaders directly, asking why they had time to push through tax breaks for billionaires, but not a minute to fix a healthcare system that millions depend on. Her point isn't just political, it's moral. Because the cost of inaction isn't measured in headlines or polling numbers, it's measured in lost coverage, canceled doctor appointments, delayed treatments, and fear. She reminds the Senate that most of the people relying on these health credits, 3/4 of them, live in red states. These are Republican constituents, farmers, small business owners, working families. The very people who are supposed to be represented by the same leaders now walking away from negotiations. And that's the heart of this speech, accountability. You can't govern by avoidance. You can't say deal with it later when the crisis is already here. The alarm, as she says, isn't ticking, it's ringing. When Senator Murray says Democrats are ready to negotiate, she's not just defending her party. She's defending the idea that government exists to solve problems, not hide from them. The contrast she paints is sharp. On one side, people trying to fix a broken system. On the other, leaders who would rather wait until the damage is irreversible. This moment captures more than just a fight over budgets and shutdowns. It captures the divide between governance and spectacle, between leaders who listen to the people they represent and those who turn away. As premiums rise and families brace for the fallout, this shutdown isn't just a political tactic, it's a reflection of misplaced priorities. And Senator Murray's words echo a truth we shouldn't ignore. You can't claim to protect the economy while breaking the systems that keep people alive. If you want to understand the real stakes behind the shutdown, the human cost behind the headlines, subscribe to Left Lens. We break down the noise, connect the dots, and give you the full picture of how politics shapes real lives. Because understanding is the first step to holding power accountable.